This is Dr. Marc Malek speaking to you about lipocontouring. And what that really relates to is manipulating fat deposits and removing excess fat to thereby sculpt a figure. Whatever curves you start with, we can enhance those curves using your own dimensions by removing certain fat deposits in areas, thereby contouring a silhouette, an hourglass shape. Some fat is good fat, so merely pinching where there's excess is not an indication of how to remove all of it. We have to look at your dimensions and make a shape. So how do we treat fat cells and what's their function? They store fat. 3 variables will dictate how that fat is stored. The central nervous system oversees that. Your metabolism, your diet, and your activity or level of exercise govern how you deposit fat and which patterns it is. If we remove certain numbers of fat cells in one given area, there will still be fat cells remaining. They are important to support the soft tissue in the skin overlying, as well as the blood vessels that feed that skin. So we can't really remove all fat cells from under the skin. Having said that, a certain population will remain behind. If your diet, your activity, and metabolism following a procedure stay constant, so will your result. If one of those 3 variables is altered, you may gain fat in the same area treated, or even more than was originally there. Now, how do we use these procedures to our advantage? There's many technological advancements that we've seen with smart lipo, slim lipo, many different laser technologies. At the end of all of that discussion, the most important variable is how much fat we remove and where it comes from, as opposed to which device is used. So really, selecting the right surgeon is invaluable to creating a great result. It's about sculpting and the artistry of your shape. I prefer to use a technique called safe lipo, SAFE. We separate the fat, and that's the S, aspirate it, remove it, and then we equalize the fat. I use a tumescent solution, which dilates the fat cells. Then I break up those fat cells, remove the fluid, including the fat, and then I reorganize the fat that's left behind to make a smooth effect. A compression garment's used for 6 to 8 weeks. At times, we can massage these areas treated with lymphatic treatments. Your soreness is typically 2 to 3 days, but up to 2 weeks of swelling. Bruising may persist for up to 3 weeks. On your consultation, we'll discuss your curves, where we can sculpt them, and how to best do that.